Well, our CFO, Lee Shapiro, likes to start every meeting saying to our people, you are not your stock price. And, we are, as you know, I have a personal relationship that really makes this intensely personal. My son was diagnosed with type 1 when he was 8. He's now 25 and doing well. But many of our people, about a third of our people, either have a chronic condition that they're dealing with or have a family member who does. So this is very personal for us. So whether the stock goes up or down on any given day, what we're interested in is what's happening, how are we empowering more and more of our members to live better and healthier lives? And that's really the focus. That said, I like when the stock price goes up.
From soaring stock prices to the news that shook up digital health, Teladoc, the largest telehealth provider on the public markets, had acquired Livongo, the chronic condition management darling that had catapulted itself to success with its July 2019 IPO. So like any good health tech gossips, what did we do? We assembled a crack team of digital health superstars to help us unpack this deal and tell us, what does the industry think about Teladoc Livongo?
Teladongo.
I don't know if you've seen Home Alone, but it would be like this. So it's pretty amazing to see these two, industry-leading companies merge and create what is really a telemedicine super company that takes a bunch of disparate parts of the continuum of care and weaves them together. So you obviously have Teladoc, who is out there with their core service, and then they added InTouch Health earlier this year. So they added this big hospital network, and now they're adding remote patient monitoring to that as well. So the implications are pretty far-ranging.
So in one hand, it makes no sense at all. On the other hand, it makes all the sense in the world. And you've got two companies that are, not making money, very much, overpriced based on traditional mechanics. But on the other hand, they're in a very hot space. And by coming together, they now have just created, by far, the big giant in the industry, and an industry that's clearly growing. So I love the deal. I think it makes it clear, super powerful number one, and makes the chase for number two all the more interesting. For Teladoc, it gave them what they really, really needed, in the sense of, for them right now, a lot of what they do, their business model is based on fee-for-service, urgent care, a little more than that. But what Livongo has is value-based capitated business models that are based on really tech-enabled services with minimal physician usage. So if by pushing on that business model, it allows them to scale and be profitable.
The concerns to me, one, are these deals don't often work. It is a huge deal. There are different cultures you have to meld. It's complex, it's hairy. And so I think that's tricky. I also think that, even though I'm in the space, valuations right now are bubbly, to say the least. And that could create, any misstep, whether their fault or not their fault, could create immense pressures on valuation, which then just makes it very hard to hire and retain talent. So, it makes me anxious to think about how it's going to go, but at the same time, I'm certainly rooting for them.
All right. Well, I think Jamie Edwards summed up just how stunned everybody was. But you were telling me that Russ has the name of this wrong. It's not Teladongo?
Yeah, of course. Everyone knows it's Tela, Ramalama Ding Dong Go.
But what Russ is right about, regardless, is that things are very bubbly.
Okay. So by the end of July, Livongo's market cap was around 14 billion, which was an incredible 27 times next year's expected earnings, which is really extraordinarily high number. Teladoc market cap around 20 billion at about 15 times next year's expected earnings, barely trying in comparison. And that's really quite extraordinary given that they're healthcare businesses.
Absolutely. So the revenue was growing really fast for both of them, but they were being valued the way SaaS tech businesses are being valued. And that's a really familiar archetype in tech, like Matthew just said, not so much in healthcare, where usually businesses are looked at as services, software side be damned.
Right. So now fast forward to the first week of August. Livongo stock hits a new high of $150 a share, basically about 20% up just in that week, and we've been going crazy. Earnings were expected to come out that day. Actually, they did come out the same day that the merger was announced, and that's the word that came out. Teladoc buying Livongo, mostly all stock deal, valuing Livongo at about $159 a share, or about $18 billion.
Mind blown.
All right. So, Jess, I did notice that both Livongo and Teladoc are sponsors of WTF Health.
Yeah, and THCV.
Of course.
So I think that after years of seeing their logos together, Teladoc Livongo, at the beginning of every WTF Health video, that we subliminally brainwashed Glenn Tolman and Jason Gorovic into doing this deal.
Excellent. Where is our 5%?
I think the check's in the mail.
Is that why Trump said the U.S. Postal Service slow down?
Why is the universe always conspiring against us? Why?
Okay, so yes, a lot of stock changed hands, a lot of money, but that's not the real point here because it was an all-stock deal, right? What was going on here was the two companies were coming together because they were trying to create a new kind of online healthcare company.
And I think part of that is we have to figure out what kind of healthcare companies these are today. Livongo out the gate started out as an applied health signals company, which was a category that they made up. And I think even till the end, we're the only company in. But what they were trying to do was capture a way to talk about how they use their AI plus AI engine to create these nudges for their members and really use technology to enable people to have better health.
Right. Teladoc actually started back in the early 2000s, and they were at Health 2.0 in 2007, 2008. And literally, you could call in.
Like on a phone?
On a phone.
Oh, God.
And a doctor would call you back, probably on your landline. Right?
Right? And what now? What are they now?
All right, so we had a little dispute before we started here about, I'm like, oh, do you prefer telehealth or do you prefer telemedicine? And what did you say to me? So,
I said, no way, we're in the virtual care business.
So I guess you might have predicted that at some point Jason thought that Teladoc was going to get into Livongo's business.
He actually says that to me later in the interview.
I really like the chronic care management space.
Okay.
I think that's an area where build, buy, and partner are all options for us.
Okay. Right. And so buy they did.
You know, actually, it's true. While the Robinhood traders and the Wall Street guys may think that the companies do the same thing and it will just telehealth, people inside the industry know they're actually very different.
I think on the positive front, Teladoc as a kind of a 1.0 telehealth company looks at Livongo and sees technology, it sees data-driven, it sees next generation, and that could bring a lot to Teladoc. I think on the other side, Livongo it's not a healthcare company, really. It's not providing medical care, and so they can now provide a more end-to-end solution. And so on the face of it, those two things make a ton of sense.
Right now, what you have with Teladoc is virtual care, where it's mostly acute and second opinion. With the Livongo, you have remote patient monitoring. So you have some of the problem solved, but they don't go deep in everything.
Yeah, so this does actually make sense, right? Because what Livongo is doing basically is providing a coach who is monitoring probably somebody with diabetes, probably monitoring their blood sugar, maybe their hypertension, some other issues as well. And then if something goes wrong in the middle of one of these interactions and they need a physician, they can, with using their, as part of their navigation, hand them off to a telehealth vendor. And I guess we know which telehealth vendor they'll be using a bit more now.
Right, exactly. So this does make sense from a tech integration standpoint, like we heard Russ and Stephanie say, but you have to wonder, are the people who are buying Teladoc and Livongo's services today going to be happy about this? What are their customers going to think?
They have payer clients. They have hospital clients. They have employer clients.
You know, I don't know what Teladoc and Livongo have planned, but from what we know, payers, health plans, hospital systems are looking for platforms that can really service millions of their members. In my mind, given that there's more than 133 million adults in the US with a chronic condition, the fundamentals are just not there. There's simply not enough doctors and nurses in the world to get people the care that they need day to day as a chronic patient.
I do think that customers tend to prefer simplicity. I mean, that's why Omada offers condition areas that we hear the most from our customers. So prediabetes, type 2, hypertension, behavioral, musculoskeletal. I think if you're a health plan, you're going to hear that from your employers more than ever, especially in the context of COVID. And I think you're going to be thinking, well, I want to make sure that there's some, choice out there in the world. So I anticipate, a number of calls at Omada.
You're going to start to see the buyers of these types of services look not for the individualized point solutions or individualized digital therapeutics that are out there, but really platforms that can meet the needs of a broad user base.
So they're going to be very happy if they can, one, have a one-stop shop where they can get more services from the same vendor, and two, if that can somehow push the price down. If you are a current client, you're probably going to start asking for discounts if you can bundle services together and maybe create some value-based models together.
Lyle! Oh God, Lyle, how could you bring up value-based care at a time like this?
Okay. Before we get to Dr. Burks, who is his amazing future of value-based care, there is a dogfight in the present.
You're right. What does this mean for the competition today?
What I'm not going to do is whiplash to immediately think that Omada needs to offer acute telemedicine capabilities. That may be a thing that our customers want, and if so, I'm confident we can deliver on it.
We've always believed in the crux of what we're doing, which is using conversational AI to extend the care so that doctors and nurses can perform at the top of their license, but that millions can be cared in personal, high-touch text message ways. We've spent 6 years building an AI nurse that achieved clinical equivalence to a person-to-person experience.
By no means does this put a lock on all telehealth. If you think about it, even if Teladoc and Livongo, took care of 10 million visits, this year, over 20 million visits, there's still over 1 billion visits that are done every year in the healthcare system. So only a small fraction are being done by these independent telehealth vendors right now. So there's still a lot of room to go, but they've set themselves up well.
So it'll be really interesting to see what happens with telemedicine that's based on, video and phone, and really where that ends up landing in the healthcare ecosystem. Does it get pushed down to the level of a provider where, if I'm a UCSF member, I just assume I can either call video or show up in my doc's office? Or does it get pushed into the cloud? If you're a provider, you're thinking about, how do I think about my telemedicine capabilities that I've been developing? Am I going to be the owner of acute telemedicine, or is it going to be, digital companies like a Teladoc?
I think the interesting thing here, as these telemedicine companies continue to get bigger and bigger, and if you take a look at someone like Teladoc or even American Well, while there's a large technology component to the business, there's also a large medical group component to the business. And so as they get bigger and bigger, the real question is, do they start competing with their customers?
So that's it. That's the problem with this deal. What Jamie Edwards said is true, but it's not well understood. The question is, do they start competing with their customers?
So I'm actually a great example of this, Janice. I am both a member at One Medical, primary care medical group, which gets me free online telehealth. I can see it, talk to a One Medical doctor. Also a member of Blue Shield, which also gets me through online telehealth, through my wife's employer. And that ends up also being a Teladoc doctor, right? So you've got that natural competition with who's providing what. Then Teladoc and Amwell, their competitors, also provide technology to incumbent providers and yet have their own medical groups. So then you've got that sort of potential competition there as well. So my old boss, Ian Morrison, used to say, this is the Ghostbusters question. Who are you going to call?
Complicating this further, you have insurers who are buying providers. So for example, United Health Group, which owns Optum, is starting to buy groups of physicians. And then you have Humana, which has its own physician practices, is a major investor in Oak Street Health, and has just signed a big deal with Heal. And then you have the Kaiser Permanentes of the world, who have always played that balance between being payer and provider.
Okay, so this is about providing care or providing technology?
Well, we've got one vote for technology for sure.
We still think that real AI, conversational AI, and care in care delivery is needed and has to be a part of that scaling future. We've got 2 million patients, but that's just the beginning for us. And for me, the most important takeaway is this. The way to deliver virtual care to a lot of people isn't necessarily through larger companies, but it's through better technology.
Right. Well, I know, Matthew, you might be another vote for the technology side of things. I know you and Indu Subaya have been talking for a long time now about flipping the stack in healthcare, which means, that instead of going for face-to-face first, providers can use technology to monitor and manage their patients.
Yeah, so I mean, if you had a system like that, you could look after every type of patient, potentially, right? You could use telehealth to get access for healthy patients with minor acute problems. Obviously, a lot of monitoring and coaching to look after patients with chronic illness. You could even look after patients who got, an acute and serious illness, such as, COVID-19. But the problem with doing that is there's a lot of complexity in such a system.
I would expect that others out there will try to build similar pathways, similar integrated systems that can deliver on the promise of measurement-based, data-driven, and evidence-based care.
So that's the promise of outcomes-based payment, value-based care.
Lyle. Sorry.
All right, whatever you want to call it, right? Payment for outcomes. We've been talking about this a lot, but and Jess, you and I have been talking about it a lot over the last months and years. I had a great name for it, but you came up with a slightly better name.
Continuous clinic.
Yeah, so are you keen for me to tell you what the continuous clinic is?
Not really,
I'm
but
going to do it anyway.
All right, because we asked, here it is. We've landed in the continuous clinic.
You didn't actually ask, but it is probably a better name than Plicimo that I used to call it.
Let's not go there.
Okay.
Explain the chart.
Well, okay. So the chart is about a patient who might be anywhere, right? So the patient might be at home, might be in a nursing home, might be in a nursing facility, even potentially could be in a hospital, but then, wherever they are. The idea is, can you be capturing data about that patient? It could be basically a healthy patient who's got a Fitbit, all the way through to somebody who's very sick, who's on a pulse ox or, has heart problems. You need to take that data, put it through a bunch of automated care processes into alerts and care pathways and get that information to the relevant care staff who are augmented. They may be in a bunker somewhere, like in some ICUs. They may, who knows where they are, but they may be at home. But their goal is to monitor and find out, the patients who need intervention. It's got to do a whole bunch of stuff, but one of the things it can do is communicate back to the patients using telehealth. If necessary, get them physical services to the home. It might be oxygen, it might be food, it might be technology itself. You can imagine a whole team and army put this all together. And all that data from all these different sources has got to be integrated and acted upon essentially by one organization. So I think this is kind of where people are sort of scratching and clawing and going to in the future of healthcare. But frankly, no one's really got that quite yet.
Does new Teladoc have the capability to do this now?
Well, I mean, they've got some of the parts of it, right? They've got the monitoring, they've got telehealth, they've got the staff. They have got some of the automated care processes, particularly in the new Teladoc Livongo diabetes side. But there's a long way to go, right?
Let's see what they're missing.
Yeah. So this is a chart from their own merge document, right? And they're talking about what have they got now to manage the members they have. And this is probably just in chronic care conditions. And yes, they've got a whole bunch of stuff around diabetes, hypertension, weight management, behavioral health. Maybe they need some fleshing out in some parts of that. But there's a whole range of things they don't have, all that blue stuff, right? There's a whole bunch of chronic care solutions, like congestive heart failure, kidney disease, musculoskeletal, COPD, asthma, and others they don't yet have.
There's a lot of people that are suffering from, musculoskeletal conditions. There's people that have cancer, maternity. You need to go deeper in mental health like we do, where you're really solving for the spectrum of mental health disorders. So these things aren't really covered yet. And so I think payers and providers and employers are still going to have to look for a multitude of solutions to bring this all together.
So those are some ideas about what new Teladoc might add. But of course, they're not the only ones interested in changing how healthcare is delivered.
If you literally just add up and tabulate the revenues that provider services bring in from providers, it's roughly like 1.6 billion a year. And the combined revenue of these two organizations is just scratching the surface of what can be done here. So I think it's healthcare is 18% of GDP. More and more of it is going to be pushed into the into the cloud appropriately. So we are just starting with the opportunities here. I really think that.
All right. So all those opportunities, you've got a whole bunch of organizations who could come in to take advantage. Some of them are already there, like the providers in the top right here. or maybe the independent physicians who are classing into new types of medical groups in the bottom right. Then you've got the big healthcare players. Most of them are now, either part of payers like CVS, Aetna, Optum United, or retailers like Walgreens and Walmart. And then, of course, you've got those teeny tiny tech companies who've got a bit of cash lying around and have been expressing a bunch of interest in healthcare. Who's going to play?
I do think that since the last 5 years, the big payers have all tried to be in this market. They all need to look at creating consumer-directed healthcare, and we're partnering with a lot of payers in that regard. And there's a demand by all the big tech companies to be in healthcare, and really they recognize that's 20% of the GDP, and they want to play in this space and create a consumer-driven healthcare experience. So I think they'll just continue to double down, invest more, maybe acquire, look at partnering. I think it'll just accelerate growth and investment in this space.
Well, Matthew, I think she's right. I mean, we've seen Amazon just recently partner up with Crossover Health, primary care provider. We've seen Walmart launch those brand new healthcare super centers. I actually think it's going to be either Amazon or Walmart that buys new Teladoc to patch in the telehealth chronic condition management with the primary care stuff they've already got going on.
Yeah, I don't know. I think new Teladoc, unless the stock price comes down a whole lot more than where it is in sort of early August, is going to be just way too expensive. I mean, those big players, especially the big insurers, have done a fair amount of buying so far. But in general, they're also prepared to build. And, when it's that expensive to buy, I think you're better off building. So we'll see how they go. So let's take a look at what they've done so far.
All right, that's a pretty good point. Let's see.
So there's been a lot of activity from health plans and other players in the sort of digital health space for quite some time now. Lots going on, filling a lot of the gaps they need, and they've done a lot of acquiring, as mentioned, digital health. So United Health Group has been acquisitive, but also done a lot of building itself. So on the mental health side, they recently bought Able2, which is one of standard sort of depression, anxiety, mental health companies. They bought a company called Pacifica and renamed that Cenvello. That's kind of a headspace woo-woo meditation knockoff, right? You've got, just the last couple of weeks ago, they launched Level 2, which is a sort of direct competitor to Livongo on the diabetes side. It's not the first thing they've done in diabetes, probably won't be the last. They've had a bit of a mixed track record there. But they're not the only ones. But they're putting together this sort of mix to build and buy, and obviously looking at the finances and the equations of that. But they're not alone, right? So Anthem has been going, which is the other massive health plan, has been working with K-Health, which is an Israeli company, which is one of the many sort of like Babylon or Ada or Boy Health is on the sort of AI front end. You're seeing a lot of activity in that area, building a sort of front end for navigation and for symptom checking. And Cigna is doing some work with your friends at Oscar, right, which gets you access to that Oscar telehealth, which is built in the front end of Oscar. They're going to be rolling that out, that partnership out in several markets. Let's not forget they're also a big owner and customer of Omada, right, in the diabetes and weight management space. So, there's a whole lot of activity going on here inside the health plan, same sort of thing in some of the provider groups, and by the way, in some of those big retailers.
Right, so what do? Do they use the new Teladoc V2, or do they just build their own?
Well, I think I've called this merger sort of throwing the cat, not so much amongst the pigeons, amongst the vultures, right? You've got the time is now. Either these big players are going to sort of build it internally and sort of really start being involved in delivering care, or they're not. If it is the time when they're going to start doing that, then Teladoc version 2.0 has got a lot more competitors than Teladoc 1.0 and Livongo had.
Well, what about those people that they've left behind? What about the rest of the digital health ecosystem? I mean, we waited 10 years and watched VC funding ramp up year after year. We had our big IPO year last year. And now this merger, but what does this do to the rest of the digital health companies?
I think this increases opportunities across the board. So there's going to be more funding for digital health. There's a recognition that healthcare is going to be rapidly changing. There'll be more investment. There'll be even more point solutions developing in areas where there are newfound ways of taking digital care and solving for key pain points that are, that are better done digitally than offline. So I just think there'll be more innovation, more investment.
I think DTX, again, as a point solution is gonna struggle quite a bit until you start to see a platform of DTX companies come together. And then in terms of digital health more broadly, and in both chronic care where we play really strongly, primary care, acute care, and emergency care, I think there's still a lot of stuff to figure out. So what I would broadly say is that this creates an immense amount of new opportunity. It doesn't close doors, it opens doors.
So this is interesting because there's a supply side and a demand side. I think if you're a smaller company right now, these exits give venture capital investors a lot of ammunition to say we should still be plowing a ton of money into digital health. And if you take a look at digital transformation across healthcare, my view, we're still in the early innings. So I still think there's going to be a ton of opportunity for smaller companies that are out there, even though people are going to be looking for more enterprise type solutions, like the solutions that Teladoc or Amwell or companies like us can provide. I still think there's going to be opportunity for smaller companies who are really making a difference in improving clinical workflows.
I don't think it's going to change all that much for these small companies. You might have some of the seeds and A's that are harder to get done because the investors are worried about, well, is Teladongo going to do this? So I think that there may be a little of that, but for the most part, I think it just leads to more and more opportunity as people realize how important digital health is becoming.
Right. Well, of course, more opportunity might mean different things to different companies, right? So it might mean more sources of venture funding, might mean new alliances, or it might mean a new logo on the door. You kind of have a theory about how logos work.
I do. So for M&A, the rule is this. You only acquire or merge with things that have the same color palette as you have because it makes it easier on the graphic designers.
This just opens the chasm huge. So I think what we're going to see is a scramble and a consolidation and mergers to try and become a number two, because by themselves, I don't think anyone can at all catch up. I mean, Teladoc couldn't do it by themselves. So I think we're going to see some major and interesting consolidation over the next couple of months. I think if you're a small niche vendor that does something really well, maybe it's opioid dependence or, just, sinusitis or trauma or speech therapy. If you have a niche, this is great because you can build that and now you've got someone who's going to buy it for you.
This space has all of the hallmarks and characteristics of a space that is ripe for consolidation. There's a ton of fragmentation. There's a lot of innovation going on out there, and so I think growth strategies for Ginger and for other companies out there will involve inorganic growth through acquisitions in addition to organic growth.
Well, that might put a lot of pressure on a lot of CEOs, including quite a few of the ones we've interviewed in this program.
If you're one of the medium-sized sort of standard telehealth companies, you're sweating it out right now.
I guess it's a question, are you going to eat lunch or are you going to be lunch?
I think I'll have a tuna sandwich.
But if these past few months of stock market craziness and incredible growth for both of these companies has done, and now this merger has done anything, I think the point is that we need to be thinking a little bit bigger.
It's kind of like the 4-minute mile where people are going to think bigger now that these two companies have come together. I think it may open the floodgates of other very large merger type opportunities, other big thinking in terms of how digital health can change how healthcare is delivered.
I think the platformization of digital health is beginning.
No doubt there'll be, impact here. And it's going to be so fun. It's such an honor to be participating in this window of healthcare innovation. It's just the most fascinating moment in the U.S. healthcare system in many decades.
So how far along are we?
I don't think anything's going to change for the next year, 18 months while this integration happens.
In my mind, this is a great beginning, but it's just a beginning.
My view, we're still in the early innings.
So like it's early innings. I'm in the early innings camp.
Early innings? Early innings? I've been tracking this stuff since 1995. Don't tell me we're in the early innings.
No, it is the early innings. It's just you're playing the second game of a doubleheader.
So I guess we're playing some kind of weird baseball. It's time to head over to the ESPN studios for the game summary. Jessica?
Right, Matthew. So thanks to our team of experts for weighing in. Here's what they had to say. Overall reaction to the deal, it's a good thing, at least on camera, Matthew.
That's what they seem to be saying, right? Well, I think that the key point was that most of them believe that the integration of telemedicine and remote patient monitoring makes a lot of sense. Telemedicine is becoming a bit of a commodity. You need to have both sides of the aisle, as it were, and that integration is something that obviously the new Teladoc Livongo is going to make be a big leader in.
Right. The other thing was that they thought customer reaction could be mixed. So I thought this was really insightful. On one hand, employers could like it because this could make a one-stop shop that can potentially bring prices down. Lyle, value-based care. On the other hand, their payer and provider clients could view Livongo, Teladoc as a long-term competitor and could potentially pull some business.
Yeah, and I think we heard enough iterations there of where clinical care delivery online could be going that we started talking about the thing that I've been describing, and you actually named the continuous clinic as a place that they could all move to. And that includes, obviously, not just online care companies.
Right, and you identified a few people who could be building this continuous clinic and who have been, and most notably we're thinking that it could be big tech and payers who have really been wading into this space by acquisitions and partnerships. They could potentially look at this new merger and say, hey, the time is right to dive in.
Yeah, that's the idea of the cat being thrown amongst the vultures. We'll see how it works out. The other thing was for the smaller guys. We asked around and got actually, I think, a lot of optimism from the CEOs. Most of them are CEOs of sort of mid-range companies who've raised a lot of money already. But there'd be a lot more money in the digital health space and more M&A, which is probably a good thing for those smaller health tech companies.
Regardless, what the overall conclusion seems to be is we're moving to an online platform for all of healthcare. But Matthew, maybe the doubleheader, you may be in the second game. We are in early innings.
Oh, sigh.
Well, we want to wish a special thanks to all of our guests who contributed their perspectives on this. Thank you so much for jumping on with us on Zoom, especially as quickly as they did. Thanks to their PR teams for the help with that. And also to our production team for helping put this together so fast so that we can help make sense of this deal. For those of you who want to continue to follow along with us, there's a couple different ways that you guys can do that. So the best place to start is the healthcare blog. If you check us out there, all of our different shows are up, as well as a lot of different editorial contributions from lots of different people across the industry who are making sense of all of the changes that are going on. You can check out my WTF Health interviews up on my YouTube channel. That's youtube.com/WTF Health. And then if you love what me and Matthew have to say about deals.
And who wouldn't, who couldn't, right.
Exactly. You can check out our show Health in 2.00, in which we answer all of your big questions about the biggest funding deals in health tech in just 2 minutes. So you can find that on the blog or on the YouTube channel listed there. If all of that is just way too complicated, just hit us up on Twitter. He is, of course, at BoltyBoy, and I am at Just DaMassa. Thanks so much for joining us, you guys. Best of luck, Teladoc and Livongo.
Telerama Lama Ding Dong Go.
Stop doing this.
Bye.